I'll go ahead and get started. Thank you all for coming today. It is wonderful to see your faces and your names. We are excited to bring this specific content to you because a lot of people have heard about GLP-1s, they're on GLP-1s, or they're considering it, or they're just curious about them. And I feel like there are so many behind the scenes conversations that happen that can give, I'm trying to think of the word, that can give expectations that aren't realistic on both sides of the coin. And there are so many different ways that we can optimize the way these medications work and really use them to hit that optimal health level. The goal is to change from a weight loss mentality into a health gain mentality. And education and implementation and mindset work is how we're going to do that. So thank you for showing up today. As you all know, if you've met me before, education is something that I'm really passionate about, especially in the medical world. And I'm excited to be here with you and help to just give you a little bit more of a well-rounded knowledge of these medications and how they can be really helpful and how we can utilize them to their maximum effect. So I'm going to go ahead and share my screen, and hopefully it'll go better this time than it did last time. Last time I had to play with it a little bit. Okay, it looks like it's sharing. Can everybody give me a thumbs up if you can see it? Okay, I'm going to put it in presentation mode so you can see it a little bit more. Present. Present. Okay, we already did the intro. Today we're going to talk about what the medications are, tirzepatide versus semaglutide, because there's actually two different medications that a lot of people are familiar with but don't really understand the differences, and they're a little confusing. So we'll go through that. Risk versus benefits. I feel like that's really important to understand with any medication you're using. Maximum success with GLP-1s, life after the weight loss phase, and we're going to have plenty of time for question and answers as long as I don't talk too much. Tammy is helping me host today.
Hey, everybody.
Yes, that's her. I'm gonna let you introduce yourself a little bit, Tammy. Go ahead.
So I am Tammy Wrestler, and again, I'm just honored to be part of the team at Freedom Medical from the health coaching side. I truly have a passion for just being alongside other humans who are wanting to be well. And so I get to use my side hustle here at Freedom Medical to do the health coaching with all of you. I say my day job, I work as an executive assistant at Denton's Bingham Greenbaum Law Firm downtown Indy. And so I love the opportunity to get to do the health coaching in the evenings with you guys. So I've been a health coach since I've been in the coaching industry since 2014. Really have slid into the health coaching side of it since probably 2020. And so what I know I'm committed to is supporting humans and learning how to live an optimized life, where we're really creating new habits to live a sustained and full life. My approach is definitely client-centered and coaching, yet joining Kayla and the team here, what I love, I also love teaching and education. And so with this piece, I get to, when I meet with you guys, I get to have that moment of, first of all, learning from you, but then using some of the education and teaching just in the way of nutrition and health and mindset. And so all those body, mind, and soul type things to create that whole body wellness. So I think I'll leave it at that. And met Kayla at a fitness facility I used to work at for the last 4 years prior to this. And so that was how just kind of a sweet spiritual connection that she and I had and how we met and connected. So it's an honor to be here and alongside her.
And we are so happy to have you. I don't
Thank
like to be
you.
the only one. So it's
Glad to be
been
here.
an honor working with you and just being able to see the impact and hear the stories from patients and about the transformations that you help them find. So Tammy's going to talk a little bit more later. If you haven't met me, I think I know everyone on the Zoom, but if anyone watches this later and we haven't met yet, my name is Kayla Huffman. I am a nurse practitioner. I trained in family practice, but I really specialize in the medical weight loss space. And we also do a lot of IV therapy as a ER nurse. That was an easy integration for me. I did health coaching for 4 years prior to opening up our medical practice, and I've been a nurse practitioner for 5 at this point, with a background in home visits, seeing patients, urgent care, and emergency nursing. All right, let's Miss Beal. So this is a little bit of a loaded slide, but it's really helpful to understand a little bit of the integration between GLP-1s and this other medication component called GIPs. If we start with GLP-1s, we think about Wegovy or Ozempic or semaglutide. So semaglutide is the raw ingredient in Wegovy and Ozempic. It is a GLP-1 receptor agonist. It was initially created for type 2 diabetes, but now we found there's tremendous benefit in weight management, but also a lot of benefits beyond that we'll dig into here in a few minutes. The way this GLP-1 peptide works is we actually have it in our body, and we're able to use this ingredient to mimic that naturally occurring hormone. And it plays a key role in regulating our glucose metabolism and our appetite. So we notice that these medications are really providing improved metabolic health, improved weight loss through appetite suppression, and increased satiety, which is another word for fullness. So you feel full earlier. But then if we combine it with a GIP, which you're going to see in tirzepatide or Mounjaro, then you also have an additional effect. A lot of people are like, what are the difference between these two medications? One is just a GLP. I have a slide on this too, but the other has GIP with it for a little extra bang for your buck, we say. And that hormone is actually naturally in our bodies, released by the small intestine in response to the food, like carbs and fats, and then it binds to those receptors and the pancreatic beta cells to stimulate insulin secretion. And then it really helps us to burn fat a little quicker and promotes energy storage, with its effects regulated by a specific enzyme, DPP4, if you're curious on what that one is. So to kind of summarize those, what does all that mean? Why does it all matter? And how does it actually work? So the appetite reduction is how the hormone works on our hypothalamus, and that's where it decreases the hunger and then the satiety, like we were talking about. So you really do see those effects when you're at an optimal dose. A lot of people are like, how do I even know if it's an optimal dose or not? We don't want you to have no hunger at all. You should have some hunger, but probably 30% of what you had in the first place, maybe 40%. You should get to a meal and then start to feel hungry versus having that food noise and hunger all of the time. It slows the rate at which food leaves the stomach and enters the small intestine, so it really does decrease that gastric motility. It enhances the insulin secretion from the pancreas in a glucose dependent manner, and mostly works when, I'm sorry, meaning it only works when blood sugar levels are really high. So the insulin will help to lower those blood sugar levels. That's why you're going to notice that increased insulin sensitivity, especially over time. So A1Cs are a measure of glucose over 3 months. So if you start this medication, you may not notice a huge difference in that A1C if you go get your blood drawn a month later. But if you're on a appropriate dose, 3 months later, you go get your blood drawn again, and you're going to notice some significant changes in your A1C. Or if it was titrating up, it's at least going to be staying the same. And over time, you'll see it titrate down. We usually wait 6 to 12 months to repeat A1Cs, just to give a good idea of kind of where everything's at. How do they work? So one of the undervalued effects of these GLP-1s is the anti-inflammatory effect. I learned about this, but then I get to see it firsthand in our patients and how, they haven't lost a ton of weight yet, but the pain is decreased significantly. So not only do we see it, a lot of people say, "Oh, my knee pain's going away because I'm losing weight." But actually, even in that first month, some people notice significant decreases in pain because of these anti-inflammatory effects, which can also reduce some systemic inflammation uh, associated with obesity, which obesity will cause systemic inflammation as well as metabolic syndromes, because that's your body's response, right? Is the inflammation. Energy balance by reducing calorie intake and promoting fat breakdown while sparing the muscle mass. Now, we're going to talk a lot about muscle in a little bit, but that's where it really promotes that fat loss and then improved lining of the blood vessels to reduce risks like hypertension and high cholesterol. What's really interesting and one of my favorite things about this medicine are these cardioprotective benefits. They found that it's actually regenerating your heart tissue and repairing it. So you're going to decrease your risk of heart attack and stroke, which was really interesting. I'm curious to see if over time that will be one of the indications that like insurances actually cover for these medications is to in stroke patients if they'll just go ahead and get them started regardless of weight loss need. So right now they're very widely used for weight loss specifically as well as diabetes, but I would be very surprised if over time these medications weren't used for the cardioprotective benefits despite a need for weight loss or blood sugar control. So only time will tell. The other thing that I wouldn't be really surprised if happened, I kind of think it will, is some sort of indication for addiction because not only does it decrease food noise, but patients are finding that it also decreases the like craving for alcohol or cigarettes or kind of things like that that can be really hard to detox from. All right, I have two slides on this because I get this question all the time and I'm a visual learner. So I thought this may be helpful for you too.
Hey,
Tirzepatide,
Kayla.
yeah.
I'm so sorry to interrupt you. I think my friend is in the waiting room
You know
waiting to
what?
Oh,
I
get
thank
off.
you. I just grabbed her.
Sorry.
Natasha, are you with us?
thank you, Tammy.
Okay, got it.
Okay, perfect. Yeah, I can't see the waiting room, so that's
I
why
know I had shut it down, so thank you
yeah,
guys.
it's hard. So tirzepatide versus semaglutide. So tirzepatide, the brand name is going to be Mounjaro, like we talked about before, and it has both components in it. So you typically do see a little bit more weight loss, pretty similar side effects. We'll talk about those in a second. They say there could be a lower risk of constipation. That's one of the things I just came back from a conference that they were talking about. I haven't seen that in patients, but it could be true depending on if you have a bigger patient population. Maybe it's a 1% kind of thing. The problem I have with tirzepatide is that the cost is higher. Truly, it's more bang for your buck. However, as we increase the dose, that cost can go up pretty significantly. If insurance would cover it, then it'd be no big deal. That's what we would start with. But even insurance is really not wanting to cover that medication because of the higher costs too. And if they cover anything. So that's kind of the tidbit on cost there. The semaglutide, I love it. It's wonderful. It's a GLP-1 only, but interesting enough, I have patients that prefer it. That's something to consider as well. You still notice a significant weight loss. I mean, we have people come in that have tried everything and gotten so frustrated and so discouraged, and then this is the one thing that actually works for them. I love science. It's amazing. And then we add some support on top of that and it's really neat the changes that can happen that we never really thought possible prior to these medications, especially without a very stringent lifestyle. Side effects, again, we'll talk about those. It's similar. Mostly the nausea is the most common side effect, and then the cost is better on the semaglutide. And then these are kind of the difference. So if you think about the GIP versus the GLP, these are the difference between them. The tirzepatide again has both. The semaglutide has just the one. If you want to screenshot that, you're welcome to. If you need the slide later, you can. The GLP-1, so everything in the in the tirzepatide is going to have the GLP-1 agonist, everything in this column, as well as these, versus the semaglutide just has the GLP-1 agonist slide. So they both do really, really well though. Here are the risks, because we can't go through an educational module slide presentation, whatever you want to call it, without the risk of the GLP-1s. The ones where they're common are the ones that I see. And I'm going to tell you how we kind of overcome those and mitigate those, whether you're on our membership program or not. It's really good to understand that you're not stuck with the side effects. I know a lot of places will just tell their patients, hey, like, just hang in there, they'll go away eventually. But there are things we can do to really make this a comfortable and exciting and enjoyable process. One of the biggest is nausea. We can send in some nausea medicine to your pharmacy. Eating small amounts at most meals is going to really help that. What we commonly see is that patients are eating to 100% fullness. And the key to preventing that nausea, it's not always completely preventable, but the key with lifestyle factors to prevent it is going to be to decrease that level of feeling full. So instead of eating until you're totally full, we're going to only eat to like 70 to 80% fullness. Wait some time. If you're still hungry, then you can eat some more. But a lot of times that fullness totally goes away. It just takes a second for your body to catch up. Or that hunger totally goes away. It just takes your body a second to catch up. So that nausea, if you're nauseous, Zofran works wonders, small meals work wonders, and it does typically get better with time. So I am with the providers on that. It does typically go away, and sometimes it'll just be a little bit of nausea, or most oftentimes none. The other thought on that is if you take your medicine in the morning, then you're going to be awake while you're feeling nauseous, versus if you take your injection at nighttime, you can actually overcome that pretty easily by sleeping through it, because sometimes it only lasts an hour or two. Vomiting, same thing with the nausea. It's not different. Diarrhea or constipation are really common. One of the things I recommend for constipation, weight loss, sleep, headaches, the list goes on, is magnesium. We've talked extensively about that. It is a mineral that most of us are very deficient in. Our soil used to have a whole bunch of it, doesn't anymore. And then we don't have enough magnesium. It can cause a wide variety of things, but if we add a little bit, we're going to prevent those diarrhea and constipation side effects. Sometimes you can get some bloating just because of the slow GI movement or abdominal pain. We like to catch any problem quickly. So if you do have constipation, diarrhea, anything bothersome, you want to definitely let us or your provider know. Fatigue. Fatigue we see for a wide variety of reasons, one of which is that we're not eating at all. So the medicine can make you tired, but also not getting enough of the nutrients can make you tired. So a lot of people are like, oh, if I eat less and work out more, then I'm going to lose weight. Yes, but you're not going to gain health. So, and your weight loss might actually stall. So Tammy's going to talk a little bit more about the health coaching, but that's why she is so integral, so that if somebody's feeling fatigued, she might say, hey, track your food. Turns out they're eating no healthy fats. They add in the healthy fats, the weight moves faster, their fatigue improves. The other components that can cause fatigue besides nutrient deficits are the medication itself. So we combine it with a B vitamin to really mitigate that. And we also coach you through it. That gets better over time as well. And we look at optimizing all the different things within your body and just seeing what we need to do. So like vitamin levels and nutrients and things. Headaches can occur in the first few weeks. They're pretty mild, if any. I don't get a lot of patients that complain about those. Tylenol, Motrin should do the trick. But if anything's really bothersome, definitely let whoever's prescribing it know for you. Then you have the more serious risks. So these are the ones that we very seldomly see, but they do happen. So it's important to kind of know what to look for. Pancreatitis is one that can cause a lot of abdominal pain. Typically, this is going to be in patients that might have had an underlying pancreatic problem in the first place. Maybe they're drinking alcohol, things like that. So make sure you're drinking all your water. Gallbladder problems can happen. Kidney function decline is really rare and usually in people with chronic kidney disease. If you have kidney problems, you can still be on this medication. I would just really recommend that you're staying well hydrated. A lot of our hunger is thirst. So as our hunger decreases, then our thirst can decrease as well. And then they had some animal studies with thyroid tumors. So there's a couple specific conditions that are contraindicated, like you cannot start the medication, but it's the medullary thyroid cancer specifically. Okay, this is the fun part. So we have to go through all the risks so that you know, and that you know that we can do something about them. But this is where the rubber meets the road and you figure out how to optimize your journey. Because if we're just doing medicine once a week, we're not going to learn that much and we're going to have suboptimal results. But if we do the whole lifestyle shift, put all the pieces of the puzzle together, you can really maximize what this medication can do for you. So my challenge to you is to flip the script from weight loss to health gain. We're so focused on the number on the scale. We really need to focus on the fact that we want to live really full lives. And this is a great tool to assist us in doing that. Tammy, do you care if I ask you some questions?
No, ask away.
Okay, so Tammy, as she mentioned, does all of our health coaching, and she is so great, but I thought she'd be a great person to come in and really give us a little bit of her experience talking to y'all every week and what trends she's noticing. So when you think about coaching, what benefits do you specifically see in patients that are utilizing these medications?
So when we look at like long-term benefits, are you looking at, or just in general?
In general, what are you seeing? What are they telling you? Like, hey, I'm noticing this with the medicine that
Yeah.
I maybe didn't
Yeah.
notice before, just doing it on my own.
Yeah, I would say when we are coaching, lots of things that I'm noticing, like mentally, physically, emotionally, um, self-talk begins to shift. I mean, when I think these maybe are more of the non-scale victories, like not just talking about weight, specifically. You've already touched on some of these. There's more energy. My knees hurt less. I don't feel as swollen. I'm sleeping better. Um, I think emotionally there is this, I feel better because I'm losing the weight. And so I think more positive emotions are coming out as we're seeing each one of them begin the weight loss journey. I think the thing for me that's most exciting that I love hearing week after week is just this awareness of, as we talk about food and just nutrition holistically. And um, again, most of us don't read labels until we need to read labels. And so I think that education piece, sitting side by side people who are asking the questions about, what are some options? What are alternatives to getting in those protein, fats, and carbs? And so I think this overall awareness for that whole body kind of thing is, again, a lot of the conversations that are happening.
I love that, especially with, when we think about protein, fat, and carbs and label reading. I feel like you are so great at saying, oh, this is what you love. Let's just switch it with this. You're barely going to notice the difference, and your macros are going to look so much better.
And that's what, and I think that's the other thing, learning like, well, I love chocolate. And it's like, well, we don't have to throw all the chocolate out. And for me, one of the biggest things I think is so important for each one is to think baby steps. And so one of the things we talk a lot about is you can't just stop. Like we can't just stop eating chocolate or stop eating the things that we love. It's how do we, for us sustaining it, it's more of how do we make those incremental little changes along the way so that we are prepared for cravings when they hit. And so I always say, rather than eating a Snickers bar, what could we eat? Or rather than drinking a milkshake or having ice cream, what are the alternatives? And so it's really helping because we all have them. I'm like, we all have cravings and it's okay. It's how do we make and prepare and be proactive in having those nutrition things in our toolbox. So when they hit, so
Yes, and food was meant to be enjoyed. We have taste buds for a reason, and
yeah,
it can be
yeah,
used to celebrate and all these things. And it's so nice when you have those alternatives in place to
yeah.
really be able to still enjoy it.
Yes.
So tell me, you touched on the second question I was going to ask. I think I asked them out of order, actually. So tell me about the long-term effects of and benefits of combining coaching with the medicine versus just doing the medicine by itself.
Yeah, I jotted some things down. So you have hit on some of these. So I think what our vision and mission is the same. It's helping people sustain these lifestyle changes over the long haul. And so as we got into some ruts and some habits in our lives, it's about changing those. So I think it's this enhanced weight loss and maintenance to be able to sustain that healthy lifestyle. Um, Kayla touched on the like metabolic health. So obviously that's a piece. Health coaching can again partner with the patients to create the balanced diet. How are we reducing stress? How are we integrating in movement? And then I think Kayla and I have talked about this too. Is the medication a thing for always? Or is there an ability at some point to reduce medications and go backwards as the patients are kind of learning and sustaining and reducing maybe the dependency on the medication over time? I think behavioral change is huge, and that's how health coaching again can be a part of that, helping to empower the patients, understanding emotional eating. We we say we get here by a lot of different ways, and so a lot of the coaching that can come from the behavioral side is unpacking some of those mindsets and beliefs around food or traditions of food, and I think holistic health improvements, reducing risk of relapse. I wrote down just individualized care. Each one of you are different. You guys, I am so sorry. Am I still here?
Yes, we can hear you. We can see
I
you.
cannot, you can? Oh my gosh, where did I go? Um, okay, so sorry about that. And then the cost effectiveness over time. I think how do you best utilize your finances and the money that you have for sustaining your creating a comprehensive plan for how are you going to go forward. So I think addressing the psychological, the behavioral factors surrounding all this really can um, be a part of helping you guys sustain the lifestyle that you want to lead for an optimized life.
I agree. I think you get such a huge return on investment because even some of the tidbits that I've learned over time, it might be the 10-second rule. It's one very simple thing that my health coach told me one day, and it stuck with me for so many years. And so the return on investment on those conversations, not just from a time wise, but a financial wise, it's going to pay off in droves. Your health is the thing that sustains you and that enables you to do all the different things. So I agree. I think in replacing those mindsets and just being kinder to ourselves, right? You're
Yeah.
so good at
Oh my gosh.
reminding us like, hey, we got to be kind to ourselves. And it's a holistic approach. there are so many parts that are just as important as the food we're putting in our mouths, even though
Yes.
that's the part that we get so focused on. And I love that you're so holistic when you coach.
Thank you.
And what would you say, like, the coaching call experience is like? What can we expect from coaching if we've never had it before? And what would you say, like, obstacles that patients get to overcome during those times? I feel like those kind of go hand in hand. So however
Mhm.
you can expand on that.
Yeah, I say 15 minutes is like drinking water from a fire hose sometimes. And so what I like to do is come in and we always celebrate the wins. Like I think it's so important for each one, even in their accountability partners or whatever, that you're always looking at one thing that is going well, that we definitely are celebrating those successes. We always do a check-in on the food, the meds, the sleep, stress, just overall the My Fitness Pal, how are they doing in their protein, carbs, and fats? What are their barriers and struggles? Um, I had jotted down, a lot of us don't know where to start or nothing has worked. And so I think the weekly touch points with clients really help them continue on the path of, I think, feeling successful. And then each session, I like to ask if they have a topic that they want to focus on so that we can kind of hit the thing that's most important to them. Um, so it can be big picture, like kind of all the little things. I mean, sometimes it's coming in and just talking about, I don't know, what happened over the weekend, or so it can be so created by whatever the client needs. But I do have a little template that we kind of run through just to make sure that we're um, hitting on the things that are important and checking in, especially on the medications, checking in on symptoms. So that generally is how it goes. We always set goals and encourage accountability. I always open up my phone during the week if they need anything. We share recipes, suggestions on what they're eating and what might be a better option, or this is the better option than that. So those are the fun things that I think is just when we're getting into the sharing back and forth and seeing each one of them try new things.
And I love celebrating wins. I feel like we under celebrate sometimes
Yeah.
the little things that make a huge difference. And confidence is built by keeping commitments to ourselves and by showing up for coaching and showing up for your appointments and, doing the daily things that you guys celebrate during your calls. Like that's what builds confidence.
Yes. And you know what? This reminds me, something one of the patients are doing is like for the accountability, the logging into My Fitness Pal every day. I mean, there's like a streak going. And so for her, it's like that accountability that she has with My Fitness Pal. And so it's celebrating that she showed up one more day and is just continuing to log and to pay attention. And so like any little tools that they bring to the table is again just little tips to help everybody keep integrating it in day by day by day by day. So
One of the things that reminds me of, this is a little bit off topic, but there was this jar method. So for every pound you want to lose, you put it in one jar, and then as you lose it, you move it to the other jar. And I think it's so fun, but kind of like the streak thing, just
yes.
a visual encouragement and aid in that.
And I do think we can't say everything is oh, this is awesome and great, because there are times that some of them come in and they're like, I've lost nothing. I'm feeling discouraged. And so we spend the time talking about the discouragement and then now what? Now how do we reframe it so that they all keep going? And
Mhm.
so again, I say our body is a machine, food's medicine, and it takes time. And some weeks it is just a sustaining or maybe a gain, depending on so again, part of that coaching and back and forth is just the reminders and to be okay, not being okay in those moments when it's not dropping off as fast or if there's weight gain, because it's
Well,
real and
and
it happens.
It happens, and you're the master of tweaks too. So
Mhm.
a lot of times I think people come to me thinking that I'm going to be the one that needs to tweak the medicine, but you beat me to the punch, right? So they'll be like, oh, I was going to tell you that this medicine wasn't working, but then Tammy adjusted my fats and turns out I wasn't eating enough. And now the scale's dropping like, I don't know what drops. So, like it's just dropping, dropping, dropping. And then they don't want to adjust their medications. So it's a really cool piece that provides so much value.
I would love to ask if anybody has questions. Do we have time? I don't know what time.
Yeah, I have a whole like section for questions at the
Oh,
end.
okay.
If
Okay.
do you want to
Yeah.
wait?
Okay.
Okay.
Yeah, go ahead.
Okay. So other tips and tricks, just because I might answer the questions, I don't know, on how to maximize that success. And if you have other like questions, drop them in the chat. I cannot see the chat right now, but we will make sure we get to them at the end. So I don't want anyone to forget them.
Okay.
So other ways we can maximize success. The hill that I will die on is muscle retention. So I apologize for the soapbox for the moment, but muscle retention is one of the most important aspects, if not the most important aspect of this entire journey. Muscle is going to give you health gain. Muscle is going to give you longevity. Muscle is going to help prevent diabetes and it's going to help prevent dementia. And all in all, if you have more muscle, you're going to have decreased risk for a wide variety of metabolic cancers, high blood pressure. The list goes on and on. What no one realizes or educates on is that one of the benefits of having a few extra pounds of obesity, of being overweight, is that you actually build a decent amount of muscle. The problem happens when you lose the weight, and 50% of the weight you lose is muscle, which happens if we don't protect it. And Tammy and I really pair with our clients well in protecting that muscle. So typically, people on GLP-1s, I see a lot of varying numbers, but I see anywhere from 33% of the weight they lose is muscle. So if you lose 100 pounds, 33 to 50 is of those 100 pounds are going to be muscle. And that is way too much. So what we do is we make sure we prioritize protein. We give clients protein goals and then weight bearing exercises, and that helps protect our muscle. So our clients, I've been able to do some numbers with the ones that I've been seeing over some time, and we've had the InBody, which measures it. We see 0, sometimes muscle gain, to 10% muscle loss. So that is a huge win because we're losing a lot more weight than that percentage. So that's extremely exciting. With all that being said, if you want to maximize this process, you have to do some sort of weightlifting or weight bearing exercises, and you have to get the protein in. I don't want your hunger to be so low that you can't drink a protein shake, because that's defeating the purpose. That's my muscle soapbox. If you want to learn more about it, feel free to ask me. I'll go on for 20 minutes, but we're slightly limited on time today. Nutrition, which we've talked about, that it's going to be important to optimize that. We work really closely to give you macros, so you know exactly how much protein, fat, and carbs to be eating. We recommend 40% protein, 30% carbs, 30% fats, and that typically ends up looking like 1 gram per pound of ideal body weight. So if you're 5'6", ideal body weight's like 140 pounds, 130 pounds, you should be getting that many grams of protein in a day. It's a lot. Undervalued, but an undervalued tool for maximizing success is sleep. A lot of people say, oh, I feel fine on 5 hours of sleep. Women specifically need 8 to 10 per night. And that will actually help maximize your weight loss too. Rest is important. And it's not only going to help you with weight loss, but it's going to help you in a million different areas of your health as well. I always say plug in the community. You're here, you're in community, welcome. We're so happy to have you. If you are a current client of mine, make sure you send me a message or something on Facebook. We recently opened up a Facebook page and I haven't invited everyone to it. The more you interact there, I think Tony and I are interacting with each other, but the more interactions there, the better, because you get to celebrate your wins with more than just Tammy. Like, you get to brag on yourself to a whole group, and we're all going to cheer you on. And you get to share recipes and share what's working for you and all that good stuff. Hydration, and we're going to do some community events. I just haven't scheduled them yet, but stay tuned. Hydration
Do you
is
have that? Do you have, does everyone have that Facebook or that website, whatever? The Facebook
the
invite?
Facebook group.
Yeah.
I think I have to, it's a private group, so I think I
Oh,
have to
okay.
invite them. But if you
Okay.
shoot, like, you have to friend me personally on Facebook, not just Freedom Medical.
Okay.
But if you do that, then I will, like, shoot me a message and I'll invite you. Yeah, I tried to do it, otherwise it doesn't work. Or if you're friends with Tony, she can invite you too if you shoot her a message. We'll take all the friends. Hydration is going to be pivotal as well. Water is like 70% or something of our body is water. If we're walking around dehydrated, we're not going to lose the weight. We're not going to feel as good. We're going to be tired. So hydration can really prevent a lot of problems and give you a lot of benefits. It goes both ways. And then supplementation, I hold supplements loosely, because if we're getting all the right foods, we shouldn't need a lot of supplements, but there is a time and a place that they're going to be immensely helpful, such as the magnesium for our soil that's deficient. We can't eat enough foods with magnesium to compensate. So kind of as we're along this journey, we'll adjust with supplements if we need to. Anyone want to know about life after weight loss? I feel like this is such a hot topic when people come in and they're like, okay, so what happens when I lose the weight? Do I stay on the medicine? Do I not stay on the medicine? What do I do? And this is my answer. Health's like the laundry. It's never actually done. So we have to have a plan for that. And everybody's plan is going to be different. Some people love the medicine and they're like, hey, this has so many benefits to my heart, to my brain, to my inflammation. I just want to stay on it. Maybe you want to, like, we can do a low dose, we can do cycling. There's a lot of different ways we can do it, but that's an option. You're not going to stay on the highest dose forever. There's also an option to titrate off of it and onto a supplement, and you can either stay on the supplement or off of, or titrate totally off. So this is really an individualized and personalized question. So we will talk about that when the time comes, and we'll do something that fits with your values, your priorities, your experience. But there's not a right or wrong, and these medications are meant to be used long term. They're still doing a lot of studies on like long-term effectiveness, but I will tell you the long-term effects from high blood pressure, heart attack, stroke, metabolic cancers, things like that, dementia, are much worse than anything they've been able to find so far. That's my 2 cents on it. Eyesight, it can affect your eyesight sometimes, but it's usually at a higher dose, and then we just lower the dose. I haven't seen it yet, but it can happen. Will I gain the weight back? So if you stop the medicine, go back to all your old habits, yes, you will gain the weight back. If you hold and you say, hey, I'm going to make sure that I continue the medication for 3 to 6 months, titrate off slowly so that we really can stay at this optimal weight, then your body will say like, hey, this is my new normal. I don't have to go back to where I was before, because our body likes normal. So if you've been at 200 pounds for 13 years, you hit 200 pounds today, 13 years later, and then you stop the medicine, your body's gonna be like, oh, I'm like 150, but I need to go back to 200 because I was there for 13 years. So that's why we titrate slowly off, and we make sure we're in that ideal body weight or goal body weight, or whatever we want to call it, to see how you tolerate it. And we fiddle around with it, and we transition really, really nicely, because you don't want to just stop cold turkey. You would gain it back then, especially if you do it the day you hit the goal. So the long of the short is it's never actually done, but you don't have to be on the medicine forever. You just have to prioritize your health for as long as you want to be healthy. It's one of those things that goes backwards or forwards. It doesn't just stay the same. And then metabolic sustainability. So the other thing is, like we talked about, it's working on your insulin levels and your glucose levels and so many things at that cellular level that some people's genetics are going to be more disposition to needing that extra GLP-1. We can do all the right things and you still might need a little extra, whereas others don't need it at all. And that's kind of how medicine is in a lot of ways. All right, questions that I get a lot. I'll go through those really quickly because I want to have plenty of time for your question and answer. So effectiveness, this is what the studies say. So the semaglutide, over 68 weeks, patients lost an average of 14.9% of their body mass. So that's a lot of weight. Tirzepatide, 20.2% weight loss over 72 weeks. We talked about long-term safety. I think initial expectations is really important. If you just start the medicine, that beginning dose is actually a subtherapeutic dose. Although a lot of people respond really well to it, it's not actually intended to make you lose 20 pounds. It's intended to make sure you tolerate it well, to make sure we can move up. So that's why that dosage price change doesn't change from the first dose to the second, because it's kind of a trial. We want to make sure that you tolerate well before you get the higher doses. But we do have people that lose 10 to 15 pounds in their first month. So it's really all over the place. But I would urge you to say, if it's not working month 1, month 2, month 3, don't give up. We have options. If the semaglutide doesn't work, we can switch to tirzepatide. You know, we can make it work for you, and we can problem shoot too. And but is it working? We talked about that earlier. We don't want your hunger to be totally gone. We want you to still have hunger at times. It is still working. And we don't need you to lose 500 pounds in a year, right? We want you to lose weight at a manageable pace. It's actually going to help with skin tightness. If you lose weight really fast, your skin's going to be a lot looser, and then you are more at risk for gallbladder problems, things like that. So, and you'll get those habits sustained if you lose it a little bit slower, but still at a pace where you will feel like you're winning. So that's always my goal, is so that you feel like it's working really well, but we're not giving you way too much and taking away from your health. Some people want to move up way too fast, and I think it doesn't do a service to the patient. And then what to look for in a program. So whether you go with us or somewhere else, I know there's some people that are going to be watching this that are out of state. I don't care where you go, but I want to make sure that you have a team of people supporting you. So make sure you look for a program that isn't just going to give you your medicine. They're really going to work hand in hand with you to help you not just lose weight, right? To gain the health. So with that being said, I'm going to stop sharing my screen. And I see questions in the chat.
Do you see them now?
Yeah.
Okay.
I might be looking to the side because I don't think I can get it to go over. You guys can't see my screen anymore, right?
No.
I'll just move my computer over. Okay. Yes, I can see the questions. So let's see. Oh, 10-second rule. I didn't go into that one. So the 10-second rule is a mindset thing. So basically, it's so funny. When I talked about it on the last Zoom. So when you eat or drink something, you get that really good, feel good feeling for 10 seconds. That's all. It's not that long. So when I'm thinking, hey, do I want to eat this or drink that? I just think, is it worth 10 seconds? And sometimes it is, but most of the time it's not. So that's my kind of 2 cents on the 10-second rule. I can do a full explanation of the science behind it, but that's how I challenge myself. Any other questions? You can pop off mute. You don't have to stay on mute.
Anybody have any questions or anything you want to just throw out or ask?
I have a question. You kind of touched on it a little bit, and I know everybody's bodies are different, but you see all kinds of different things. But as far as the insulin in your body working, does being on the medicine in any way after you go off of it, you see things that say, well, it stopped your body from producing its natural insulin. because you've been on this medicine for so long. I didn't know if you guys had a thought on that.
So testosterone, if somebody's on testosterone, that is something that will definitely do it. I have not heard that with these medications. You know, there is a risk of weight regain. The problem is too with that is that if people stop the medication and regain the weight, they're not going to regain the muscle back. They'll just regain the fat in place of the muscle. So that's the big problem there. But as far as your insulin resistance, I do not believe that your insulin resistance would get worse than it was in the first place. I think it's probably going to be better, especially if we're implementing all the lifestyle shifts. However, if your metabolic system needs that extra assistance from this medication, then it's probably going to go back to the baseline of where it was before. Does that make sense?
Sure.
Good question.
Yeah, that's a great question. And I'll do some research. If I find out anything otherwise, I'll definitely let you know, but I don't think so.
Okay.
We can celebrate wins too. If anyone has wins, questions, can be brave.
I think one
Celebrate-
thing, oh,
Sorry.
go ahead. No, go, Gina.
I can celebrate wins. My birthday was last week, and I felt like for some reason everybody thought I needed cupcakes and cake. So I kept getting these things delivered to my house with, lots of, that's because that's just how people celebrate. So, but I felt good about it because when I was with the person, I had a little piece to, to make them feel like I had it and stuff. And then when I got home, I threw it away. So, and I was totally okay with that.
Well done.
Yes, and happy birthday.
Oh, thank you.
That's so exciting. And it's amazing how our bodies just change and the cravings change and the willpower changes and
Yeah, it didn't even sound good.
That we really throw away cupcakes.
Yes. It's mind blowing.
Not always, but yeah.
anyone else have anything? Okay. Well, thank you all for coming. I really appreciate it. We're going to do some sort of giveaway. So I haven't decided what that is yet. If anyone has ideas, let me know. I was trying to think of something and then I was like, I don't have any. So if anyone has ideas, let me know. But otherwise, I have the names of everyone that is here and I will do a little giveaway and announce it on the Facebook page or social media probably. And you'll know if you're the winner. I'm going to put all your names in a hat. I'll do that. I'll pre-know what the giveaway is next time. It's going to be great. But I didn't know if it would be more clients or more people who were not clients. So I wanted to make it kind of comprehensive to whoever showed up. So how I like to end these, if you want to stay, you can. If you do not want to stay, you do not have to, but I do like to end in prayer. So if that's not your thing, feel free to jump off. Otherwise, I will pray us out. I just want to thank each and every one of you for coming and showing up. It really means a lot to me personally. And it's exciting for you because you get to have the information you need for that long-term success and to be able to educate. We're all having conversations all the time. And there's so much misinformation out there. That's why I really wanted to do that. And now you're going to have the right knowledge to be able to share with people so that they can get the correct information. And that's a true gift. So, Tammy, do you have anything to add before I pray us out?
No, I just am reminded as we're sitting here, it's just reminding everybody it's small incremental steps. And I say movement, what I've learned just by listening and showing up with you, with many of the clients and patients, is movement has kind of gone by the wayside in any kind of resistance training. And so I know it seems overwhelming, because it's like, what do I do first? And how do I integrate all this stuff in? And I think I just want to continue to be an encouragement that I say it starts with 2 or 3 pound weights while you're sitting watching TV. You know, you can do so much in a chair. There's so many ways that I want to support you in. How do I start moving when I haven't moved for 5 or 10 or 15 years? Like, I don't even know what to do. And so I think that's just a piece that I want to support and help in any way that I can, to give ideas of what's it going to look like as this weight is dropping off. How do I start? Where do I start? And so there's lots of simple ways to be able to start the resistance and the moving our bodies, because again, that's a lifestyle change that we get stuck in, and it's hard to jump back in. And so I don't want to, it's real. And so anyway, that's a piece that I just want to offer support to anyone.
I'm glad you brought that up. I'm working on 2 different things for that. I'm working on
Okay.
a list of YouTube resources because they're free.
Okay.
I'm also working on a collaboration with someone who does online classes.
Ah, that's awesome.
So stay tuned. It's on my list of things to do this
Okay.
week, actually. I'm glad you brought it up because you are so right. And it's integral to that muscle piece.
Yeah. Yep.
Hey, Kayla.
Janelle, go ahead.
Yes, that was something that I had thought about too, is just that you do see, like all these different exercises, and it's hard to actually just put together a 15, 20-minute routine of, okay, what should I do? It's like, oh, we'll do this one, 15 reps, or 40, but there's so many of those that I've been trying to look to find a routine of, especially with the free weights, of just doing,
Yes.
so many repetitions of this, and this, and then do, so that's something
Now,
I've
are
been
you at
looking
home?
for.
Are you looking for at home things?
Yes.
Okay. Yep. Okay.
So I think that'd be a good resource to throw out there at some point too, to kind of just have an actual format of, something you could do.
I think we'll put it together between Tammy
Awesome.
and I, figure something
Yeah.
out. And I'll work on those other ones too. Thank you. Feedback. We love feedback. So.
Mm-hmm.
All right. I'll pray us out. God, thank you so much for bringing us together today and giving us the time and ability to learn and to grow with each other and to find community. We just thank you for this holiday season and just being able to be with our family and friends, and give us comfort for the family or friends that we're not able to be with for whatever reasons, and just fill us with peace and help us remember that amongst the hustle and the bustle, this is a season about you, and just connect with us in ways that are so obvious, and just grow our faith and help us to be able to pour out into others that might be having a difficult time in this season. And I just ask you to bless the health journey of every single person on the Zoom and those that couldn't make it, and just give them wellness for many, many years, and success and confidence and a newfound energy and joy and movement and in nutrition and all the fun things. So God, we love you so much. Please bless every single person on this Zoom and their whole family and friends. In your name we pray. Amen.
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 Thank you all. It's a pleasure meeting you.
Thank you.
Thank you.
Bye, everybody. Take care.
Bye-bye.
Bye.